The question that we get all the time is whether or not a disc replacement is a better operation than a fusion. And this is a question that deserves a little bit of explanation. It's not a complete yes or no answer because not everybody is a candidate for disc replacement. So if you are a candidate for both, I would tell you that absolutely I would encourage and recommend artificial disc. And the reason is because we know, based upon long-term data, that if we do a disc replacement, we are allowing for the spinal levels to move naturally. The levels around the surgery don't have to work harder, and they're not going to wear out faster than they would if we did not do a surgery. With fusion, if we take away movement at a spinal level, the surrounding levels are going to work harder so that you don't notice a difference in your overall motion. But by working harder, they wear out faster. And it does increase the likelihood that over the next 7 to 10 years, you may have an issue at one of those surrounding discs that could lead to another surgery. So if the playing field is equal, and I tell patients that if we're comparing apples to apples, absolutely. Why would you not want the disc replacement? It's going to decrease the long-term potential of more surgery, and it's a faster recovery. Unfortunately, if you're not a candidate for disc replacement for any number of reasons, then the only option might be to consider a spinal fusion. And what I would say to make you feel better about that is what I tell all my patients. The clinical data is such that your improvement of the symptoms you came in with should be equivalent, whether we take out the bad disc and put in a device that moves, or whether we take out the bad disc and put in a fusion cage. That's not the issue. So you will still do well. You will still be able to improve the back or leg pain or neck or arm pain that you came in with. You'll have a longer recovery from the fusion, and there is a potential down the road that perhaps you'll need another surgery, but it's still the option that can help to get you back to where you want to be.